Hello, everyone. Amanda and Sumaiya are partners for this disability presentation, and today we would like to educate and inform you all about a neurological disability known as Tourette syndrome. We put together this presentation so that as teachers, you all will have a better understanding of what this disability is, the things you must know when having a student with Tourette syndrome, as well as the instructional strategies you could do to help a child with Tourette syndrome. We hope you all enjoy it. So, what is Tourette syndrome? Tourette syndrome is a neurological developmental disorder usually prevalent during the childhood years. Tourette syndrome involves involuntary motor tics and one vocal tic sound, usually could be separate or together. Some of the examples of these present among children could be blinking, throat clearing, coughing, sniffling, uncontrolled repetitive muscle and body movements, facial movements, and even neck stretching. The vocal tic sometimes won't happen at the same time as a motor tic, but some examples of a vocal tic is grunting, snorting, giggling, screeching, squeaking, coughing, and even saying certain words or phrases repeatedly. Tourette syndrome involves unwanted sounds, more commonly known as tics, which can't be controlled at all. Tics can also vary over time. Although the cause of Tourette syndrome is still unknown, research indicates that it is said to be genetics in family genes, environmental and developmental factors within the family can also be the reason. However, it is still at an unsure standpoint overall whether they have anything to do with the cause. The link on this page will give you a better visual representation and idea of Tourette syndrome, so be sure to check that out. A brief history of Tourette syndrome. Tourette disorder, a neurological disorder, was named after a pioneering French neurologist named Dr. Georges Gilles de la Tourette in 1885. He first discovered this neurological condition in 1885 when he questioned about the symptoms that were relevant in an 86-year-old woman at the time. He first referred to it as maladie des tics, which meant sickness of tics. Research says that, quote, Tourette syndrome occurs in 1 in 160 school children, unquote. However, a lot of the time children may have this syndrome, but they, along with their parents slash caregiver, are not always aware, so it goes undiagnosed most of the time. Some learning characteristics teachers must know of those with Tourette syndrome include children who have Tourette's may have difficulty when learning. They may have trouble concentrating in school because they are trying to control their involuntary tics and movements they have. He or she may say or even do inappropriate things throughout the class. They may even have to take small breaks from learning instruction time to release those symptoms they have. They may also need to engage in relaxation methods to reduce the intensity and amount of tic/movements that they have. He or she may also have social issues, which can include even being absent from school and feel that other students are making fun of them. They could also be depressed and have psychological distress because they're having trouble focusing on school slash interacting with others because they might think that others are making fun of them. They might think that other students don't want to be around them because of their syndrome. Some common difficulties children may have. They might have problems concentrating in class. They may have handwriting issues such as dysgraphia, refusal to write, always wanting to write neatly, difficulty completing homework or not even doing assignments, perfectionism, wanting to do things right, and frequent erasing of their work, disorganization, managing time, managing and following tasks in a classroom environment could be really difficult for them. Difficulty following directions, repeated asking about them, sensory issues, sensitivity to light, touch, smell. Child may need to chew on a certain object to relieve urge for tics. Impulsivity issues may have the need to shout out answers, responses, and engage in impulsive behaviors. Stress and anxiety, difficulty with social skills, and even misbehavior in school or at home. Some teaching strategies, tips, and instructional techniques we think teachers could use in their classroom environment to better help their students with Tourette syndrome are encouraging students to do their best, as this would stimulate and help their mentality and feel that they are more encouraged and more engaged to do the classroom work without feeling that they are being criticized or being um, ridiculed for their learning disability. Also, communicating with parents is a major tip that we have with their parents, with the caregivers, counselors, and even promoting just that communication of child's strengths and weaknesses that they might be having in the classroom as well. Um, Assessing and observing what accommodations can be made according to the child's difficulties, and as a teacher, assess, adapt, and accommodate. Give special consideration regarding instructional activities and assignments. Make sure to be patient, understanding, and give extra time for those students who need it. Make sure to reduce their stress/anxiety they may be experiencing by being creative with instruction that meets the child's specific needs. Always look for ways to reduce classroom stress. Some strategies and instructional techniques recommended by professional research. The first is having and implementing a teacher training workshop so that teachers could be more well prepared and have more knowledge about how to differentiate instruction for students with Tourette syndrome to best meet their learning needs. When teachers are well prepared through training and have sufficient knowledge and training before teaching, they learn all about Tourette syndrome, and from this workshop, they get different perspectives about how to better attend to the students' needs. Another way is to always make sure we teach the child to self advocate, allow the child to choose when he or she needs support, either pair the child up so the child doesn't feel excluded from activities, could also tell the classroom if the child with Tourette syndrome is comfortable and raise awareness about it, have assistive technology devices, as well as make sure to notify other substitute teachers, school personnel. This is important, especially by families' permission. Communication, as research says, is the main priority. So, if teachers have good communication with families and staff in the school, the child will be better aware of the instructional activities. Another very important instructional strategy recommended by research is we as teachers could break down the assignment into smaller frameworks such as math problems. We could even give them one sentence at a time or give them one paragraph to read at a time, depending on the subject. So, a final strategy is recommended is to make sure teachers are not in this alone. Oftentimes, teachers they are worried that they are not well prepared, might not be educated on how to deal with a child with Tourette syndrome. They might not even know what Tourette syndrome is or how they can facilitate and foster to their specific needs. So it's important that whether it is a collaboration with a teacher aide or school psychologist, but just like even reaching out other to other school facilities with the support of the parents is important because the more awareness and acknowledgement teachers have, as well as the support system, the more comfortable the child will feel knowing that the instructional activities meet his or her needs. Um, when we listen, when we observe as teachers. As a last final note, Tourette syndrome awareness is coming up from May 15th to June 15th. Teal is the official color. We should all show our support and raise awareness of Tourette syndrome as much as we can. We feel that the misconception of the syndrome is that it's mostly not only goes undiagnosed, but the fact that not more people are aware of the syndrome and aware of the effects of the syndrome and how it impacts our children's daily lives is really important. The more awareness there is about Tourette syndrome, the more knowledge everyone will have, the more we can attend to their needs and wants and their specific strengths and weaknesses. We could alter and adapt our curriculum and instruction to meet those needs. It's important that we spread awareness of Tourette syndrome because it is something that affects our children in more ways than one. It affects their learning ability, affects their social, emotional, and developmental growth. And the more we are aware and the more we are educated about this syndrome, the more we could do to help our students. We thank you for watching our presentation, and we hope you really enjoyed it and got a better understanding of Tourette syndrome and how we could, as teachers, help our students with Tourette syndrome in the future when we are teaching in our daily classroom environment right now. Thanks.